Well, good afternoon, everyone. Thank you so much for joining us at this October 7th Kupuna Caucus meeting. Representative Troy Hashimoto here. I think Senator Moriwaki is running a little bit late, so she'll be joining us momentarily. But we just wanted to welcome all of you and thank you for joining us at this modified. We're having some issues and trying to line everyone up at our regular 2 o'clock. So we had to change it to our 1 o'clock time. And so I think what the purpose of today's meeting is really about is we wanted to focus more on kind of the hearing aid components that the Kupuna Caucus was really trying to figure out and assist in those areas. But it's, I think after sitting through a few presentations, it's a complex issue that, you know, has a lot of people involved that has to really try and come together and find some resolution. So to get some clarity, we've asked both Kaiser and HMSA to kind of give some of their perspective on, you know, what it would take to remedy the situation with covering hearing aids. And so we have Jonathan Ching and Lindsay Garcia, both from HMSA and Kaiser, who have graciously agreed to give us a quick presentation. So I will turn it over to both Lindsay and Jonathan to see, I'm not sure who's gonna go first, but I know they have a quick rundown for us. So Lindsay and Jonathan, John, I'll turn it over to you.
You want a John Kenpo, Lindsay? No, I mean, I'm happy to go first. So aloha, I'm Jonathan Ching. I'm the Director of Government Relations for Kaiser Permanente here in Hawaii. You know, thank you very much to Senator Moriwaki and Representative Hashimoto for allowing us the time to present to the Kupuna Caucus. A complex issue, certainly. So when Senator Moriwaki and Representative Hashimoto reached out to us, there was a lot of they had some questions with regards to the new FDA over-the-counter or new final rule that was recently passed by the federal government. And so it was a FDA final rule, and that was just I think finalized last in August. So both HMSA, Lindsay and I wanted to provide a presentation to the Kupuna Caucus to kind of level set, I guess, where we as two of the larger health plans in Hawaii are with regards to coverage for our members or members across, you know, the different, as we say, lines of business. So, you know, whether you have private insurance through your employer, like a commercial, Medicare or Medicaid, you know, we both have put together a really short, but we think hopefully I guess you could say a good presentation that would help to clarify some of the confusion that's out there, and then to talk a little bit about what we know about the federal that new federal rule, which really specifically addresses over-the-counter hearing aids. So if that's okay, Representative Hashimoto, but if I can just share my deck. Okay.
Yep. Go ahead, John. Thank you.
Can I? There we go. Hold on one sec. Apologize.
Like I only have one dog and I have to get a maximum amount. I can discount mine.
Can we mute Melody?
That much money, and it's not really going to hurt me at all. So, and I know people are going to take good care of me.
Kaylee, can you mute? Mute.
Yeah.
Now,
Can you
just
mute Melody?
to build
Kaylee?
Melody's confidence, you
Can
don't want
everyone?
to.
Oh, yeah. So
Thank you.
I'm just gonna it's a short deck that I'm gonna run through, but just really quick overview for who we are. So Kaiser Permanente Hawaii, we are a health maintenance organization. So we're both the insurer, but we also provide care for our members. So we have as of last month about 260,000 members. That does include both commercial, Medicare, Medicaid. We have about 20 facilities throughout the state, and then one acute care hospital, Honolulu Medical Center. In addition, as I know Representative Hashimoto knows, we also have I could say a sister hospital in Maui Health System that is a community hospital, so very different than what you traditionally think as Kaiser Permanente, but it is a Kaiser Foundation Hospital, which is coordinating care for all of Maui County residents, not just Kaiser members. So we're the only 5-star Medicare plan in Hawaii, and really great news. I did just find out this morning that we also just received that 5-star Medicare rating again for 2023, or 2022, which is really wonderful news. So to kind of quickly sum up what I was mentioning in my introduction, I'm going to just walk through what we currently cover for our members. So for commercial plans, which are, for the majority of folks, maybe of my age, right, that get their health insurance through their employer, very thankful to the state legislature, over almost 40 years ago that passed the Prepaid Healthcare Act. So a lot of folks who get their health insurance through their employer have really, 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 really rich benefits and pay very little, right? Their employer, on the backs of the employer, cover quite a bit of the premiums. So for the majority of folks who have commercial or private health insurance through their employer, our current benefit is up to 2 hearing aids. So that's 1 for each hearing impaired ear. And that's once every 36 months. So try to just get it really simple. And I'll just move through the different plans, and then I'll kind of summarize, and then I know there'll probably be some questions. So for Medicare, Medicare specifically our Senior Advantage Part C, these are things that are—
John, real quick,
Yes.
are you sharing your screen? Because we don't see it.
Oh, wait. Okay, why am I not?
There we
Okay.
go.
There we go. Okay, I am sorry about that. I really apologize. There we go. Okay, can you guys see the slides? Is that better? Okay. So yeah, as I was saying, for commercial or private insurance, it's 2 hearing aids, 1 for each ear, once every 36 months. And then I was just talking about for Medicare, right, which kicks in once you hit age 65 for Senior Advantage. These plans, unfortunately, do not typically include hearing coverage. These are all administered by CMS, right, the Center for Medicare and Medicaid, right? That's the federal agency, right, that oversees this. So unfortunately, there are, and this isn't anything that Kaiser's doing, and I'm sure Lindsay will share the same, right? This is just something that the federal government, as far as benefits, aren't providing in Part C. That being said, we do offer supplemental, I guess you could say, a supplemental benefit or rider. That is something that the Medicare beneficiary would have to purchase. So that's an Advantage Plus program. And on there, as you can see, it does provide, it is a cost of $44 a month to the member. But what that allows for is a $1,500 allowance that can be used to purchase, 1 or 2 hearing aids, and that's once every 3 years. So similar to the commercial with a 36-month window. For our for our members who are on Medicaid, a little bit different, right, than Medicare. While Medicaid is a federal program, it's administered by our state MedQuest division, right, in the Department of Human Services, currently administered by Dr. Judy Moore Peterson, who's a wonderful partner to work with. This benefit is a little more robust, I would say, than others. So the Quest integration covers a hearing aid at a $0 cost share, and that's with a limit of 1 hearing aid per ear every 24 months. But there's a $0 cost share to the member, 1 hearing aid every 24 months, and that does cover diagnostic services, screenings, the fitting once every 3 years, and then corrective services. So as you can see, kind of the 3, either commercial, Medicare, and Medicaid, Medicaid probably has the most robust coverage. And rightfully, these are, folks who are on Medicaid, qualifying for Medicaid are eligible lower income, blind, disabled residents. So quickly, as I referenced in the beginning, how does that new federal rule allowing over-the-counter hearing aids impact Kaiser Permanente? So as I mentioned, just in August, the US FDA issued a final rule to allow consumers with their own perceived hearing impairment to purchase over-the-counter hearing aids, and that's directly from retailers without the need for a medical exam. And so that's kind of a big difference than what current insurers are providing, in that you go to a audiologist and there's a medical professional who deems that you have a hearing impairment and you need hearing aids. So one of the things that we were able to clarify with Representative Hashimoto and Senator Moriwaki is right now, or the final rule did not include any health plan or Medicare coverage requirements. And so as a result, as of right now, for Kaiser at least, we're not anticipating any changes to that coverage, which I mentioned. We are our own retailer, right? We are able to provide hearing aids at our pharmacies, and so at this point, we're not planning to cover or offer these over-the-counter hearing aids right now. But it is a little bit early, I guess I could say. I know our benefits folks are meeting. This new rule was just implemented, and as far as the implementation, because the law doesn't require any health plan coverage, I mean, that's kind of the immediate, but we are looking of, what are the effects, what are the best ways to ensure, if members, want to purchase this, obviously it wouldn't be coverage, but, providing these over-the-counter hearing aids. So yeah, this is kind of just a quick summary, which I referenced in the earlier slides, and I think we shared this deck with the caucus, so I'm happy to have it available. But that's kind of the quick down and dirty of what I have, and I'm happy to answer any questions as I can. So thank you very much.
Thanks, John. That was great. Lindsay, do you have anything further?
I do have a presentation as well. It's actually quite similar to John, so I could just go over very, very quickly.
Yeah, go ahead.
John, is it okay if I share screen?
Yep. Let me. Oh my gosh, wait. I am having. Okay, wait, Lindsay, I'm just gonna jump and then I'll re-jump back in. Sorry, I'm having a quick thing. So hopefully
No problem.
we can do this. Okay, go ahead if you can.
Okay. Can everyone see my PowerPoint?
Yes, we can. Go ahead. Thank you, Lindsay.
Excellent. So good afternoon, everyone. My name is Lindsay Garcia. I'm from HMSA. And I just wanted to basically, our presentation is actually quite similar to Kaiser's, and in a sense that it shows, we are aligned pretty much on when it comes to this issue. So just a little bit of background about HMSA. We're a nonprofit health plan. We're 84 years old. We were established by social workers here in Hawaii in 1938. And we've grown to now serve over 773,000 members statewide. And we offer commercial, Medicaid, and Medicare Advantage health plan coverage. So for those who receive their HMSA health insurance through their employer, hearing aid coverage is available. We cover one hearing aid per hearing impaired ear every 60 months. We cover medically appropriate hearing aid models with standard features. How much you pay varies based on how much the device costs, as well as the cost share and annual deductible you selected through your employer. Repair is often covered by the device warranty. But what happens if you need a new device before the 60 months are up? Well, flexibilities are built into our plans for medically necessary reasons. For instance, if your hearing loss worsens in that time period, or the device is out of warranty and can no longer be repaired. In that case, your provider would need to submit a request to us. All hearing aid requests are reviewed by HMSA internally by our medical management team of providers. So that's what our commercial coverage looks like. Now, when it comes to MedQuest, MedQuest is Hawaii's Medicaid program. Medicaid provides healthcare coverage to certain categories of individuals, including children, pregnant women, low-income adults, and so forth. So when it comes to hearing aid coverage with MedQuest at HMSA, referral to an ENT specialist is required to determine if otological disorders are associated with hearing loss. Quest coverage allows for coverage of hearing aid devices once every 24 months. And if you need a hearing aid replacement sooner, replacements are payable only if current hearing aid is beyond repair or needs frequent repairs. Okay. When it comes to Medicare, just echoing what John has outlined in his presentation, Medicare and Medicare Advantage plans are regulated by the federal government. So in this case, unfortunately, state legislation does not apply. Unfortunately, in order to keep our Medicare Advantage plans affordable here at HMSA, we do not currently offer a supplemental benefit for hearing aids. And though there are some Medicaid Advantage plans out there available in Hawaii that do offer the extra benefits that original Medicaid doesn't cover, like vision, hearing, or dental. So when it comes to the history of state legislation, the Office of the Auditor published a report in 2014, which was a study on the proposed mandated health insurance for hearing aids based off of SB 309 from the regular session of 2014. And that required health insurance policies and contracts issued after December 31st, 2013 to provide coverage for the cost of hearing aids in their base plans. The report found that the social and financial impacts would be insignificant as the measure required plans to start providing coverage because the insurance companies that were surveyed had actually already provide coverage or were planning to provide coverage for hearing aids. And so it was not found to be necessary legislation to pass at that time. And then in earlier this year, we have a new resolution, which is triggering another study from the state auditor. And we are awaiting the state auditor's request for information regarding HMSA's hearing aid policy and coverage. But again, it's important to note that no state legislation will have an impact necessarily on the Kupuna population in Hawaii because when it comes to Medicare and Medicare Advantage plans, again, that is regulated by the federal government. This slide is actually very similar to John's, where he already went over the new FDA rule. So something that could have an impact on the Kupuna population is this new rule. The federal government has identified nationally that there is a gap in providing access to hearing aid devices. And in order to increase access, the FDA passed a new rule allowing the sale of hearing aids over the counter. This means that you can go to Long's or Walmart or even online and purchase hearing aids for mild to moderate hearing loss without a prescription from your doctor. This would be similar to going to Long's to buy low power reading glasses without a prescription. It is meant only to address mild to moderate hearing loss in people 18 years of age or older only. We do not know the long-term impact of this new rule. And internally at HMSA, we are still evaluating whether this will lead to any changes, but it is important to note that there, as John had stated, that there is no coverage mandate related to this new rule. So hopefully, I hope this answers a lot of the questions that you all might have, but John and I are here to answer any others.
Thank you, Lindsay. That was great. And John, I think what we'll do is we'll hold questions because we have a few more presenters. We want to get through them, and then we'll come back. But we were supposed to also hear from Robert Tosignan for coverage with for medically necessary hearing aids. So Robert, are you here?
Yes, I am.
All right, Robert, go ahead.
Well, so to begin with, kind of back to what the issue with the FDA stuff is initially determining what is a mild or moderate hearing loss. I think that's kind of the gap there. And so what we do really is test people's hearing to determine candidacy. And that really is something we need to find out if it is a sensory neural hearing loss or something that might carry a conductive component, or which would require attention from like an ENT or something further in addition to just hearing devices. So with the FDA's over-the-counter thing, that's just really the biggest gap, is that they've deregulated things, which is going to cause a concern for people to be either fitting themselves with hearing aids that maybe they don't even need, but also with the concern that they could potentially be actually giving themselves more amplification than necessary, which could also lead to damage to their hearing. So, you know, if we were going to pass anything, I think just a couple of things need to be placed there. And that is, number one, who is deemed competent to, I guess, prescribe hearing devices. And currently we have a licensing law in place for people that are considered hearing aid dealers and fitters. So I would just say that we ultimately leave that in place. And so if we're going to pass a benefit, it would need to be applied to those that possess that license to actually dispense devices and prescriptively fit hearing aids. But then in addition, whether it's going to apply to women or children, or sorry, men or children, or men, women, adults or children, or both. And then also, if that's going to be over a 36-month period or a 60-month period, whatever the duration is going to be. You know, so there's just a few things, again, if we're going to actually implement it, again, I think it should apply to only devices that are not over the counter. And so again, fit prescriptively by somebody that bears a license to do so.
Okay, great insight. Anything else, Rob?
The only other questions that I would say is, you know, if there's any opportunity to open the door to, like with Kaiser, you know, I think that's one of the issues with their network, is that people are kind of bound by Kaiser's only their own providers, if you will. Like, so for hearing aid coverage specifically, to my knowledge, the only place that people can get hearing devices is through the Moanalua Clinic, you know, so either, you know, having just a little more accessibility on that regard, or if they don't have clinics in their areas where other providers may be able to contract, not necessarily myself, but anybody that they would choose to allow to operate within their network, just to, again, to expand the coverage to more people on outer islands as well.
Okay, great. Well, thanks for your perspective. Hopefully you can stick around so we can open it up for questions. Folks might have some questions, but we wanted to get all the presentations done. So we'll move it along to discuss real quick the Medicare coverage. And we have Wanda and Candice from SHIP. So Wanda and Candice, you want to take it away?
Yes, thank you so much for inviting us. I'm Wanda Nayonishi, Ship Director, and with me is Candice Nakamoto, my colleague. So as Lindsay and Jonathan have said, there's no changes to the Medicare traditional coverage, which is Parts A and B on hearing, and Medicare Advantage plans, Part C may offer coverage of hearing aids. So my interpretation of the new FDA rule is whether a person has Medicare or not, and they're 18 years of age and older, and they believe they have mild to moderate hearing loss, then they can go into a store and purchase an over-the-counter device, similarly to someone who is farsighted and can just go to a store and buy readers. But yeah, Candice and I have attended many webinars over the past 2 weeks on Medicare changes, and that wasn't one of them. Hearing aid coverage by Medicare wasn't one of them.
Mm-hmm.
Okay. Anything else, or you just want to stand by for questions?
Yeah, we do have materials that we can share about the changes to Medicare regarding the Inflation Reduction Act. So I think Candice can put that information into the chat for anyone who's interested.
Yeah, no, I think that would be, generally speaking, I think not only for this issue, but probably for other issues that, folks may be experiencing. I think that would be good information to have. So thanks for providing that.
Yeah, and so if you're interested, I'm sorry, Candice, if you're interested, we also have a presentation on the changes to Medicare in 2023 that Candice put together.
So I can chat the 2023 Medicare amounts chart that I kind of put together, as well as the Inflation Reduction Act broken down into the years and what will change. So I'll do that in the chat.
Okay, that's great. I think that's helpful. Keep our options open, understand what, I think it's sometimes difficult to keep track of all the changes that are happening. So hopefully you can stand by as well. We have one more presenter and then we can open it up for some questions. Last but not least, we have our auditor, Les Kondo, who, I think has been trying to work with us to help us get a grasp of what does this sunrise analysis look like. I think he gave some really good perspective. I saw an email going back and forth. So, auditor, maybe you can give us some perspectives of what we need to be on the lookout for or what your plans are moving forward.
Sure. Can you guys hear me? Okay. Hey, thanks for having me back. And I apologize because I'm the person that asked that this meeting today be moved up. I have a flight to catch, so I don't have tons of time. I'm going to have to get out of get to the airport, within about 15 or 20 minutes. Anyway, thank you for having me. I had a chance to talk to all of you about the Sunrise or the assessment that we are asked to do, the mandatory health insurance assessment that we're asked to do whenever the legislature is proposing to mandate new health insurance coverage. And I'm going to talk a little about that, I guess, but not nearly in the depth that I spoke of last time. I think the purpose for Senator Moriwaki and Representative Hashimoto inviting me to come back is I've been having conversations about whether or not there's any value in my office doing the report, doing the assessment. And what I mean by that is, as I think all of you know, right now, the current bill that is proposing to mandate insurance coverage for hearing aids, it's limited to the hearing aid device. It doesn't include other costs that are associated with the hearing aid. And I've heard many of you talk about the other costs when I participated last time, whether it's the adjustments to the hearing aid, whether it's a diagnostic assessment to be eligible for the hearing aid. But right now, the bill as it's presented to us is only about the hearing aid device. That's it. So my office is charged with assessing both social and financial impacts of the proposed mandated insurance coverage. And we look at the bill. That is our starting point, and that is as far as we go. Other people who may think that there's other costs that are associated with hearing aids that we should be assessing in terms of possible mandating that coverage, the legislature needs to give us that direction. It's a policy call by the legislature as to what they believe or they want to consider in terms of mandating insurance coverage. our mandate is only to look what's given to us. So right now, as I mentioned, the bill that is before us is only the hearing aid device. I also understand, and it's confirmed today after hearing HMSA and Kaiser, that hearing aids are generally covered under their policies currently. And I think that would be generally the same for the other insurers that have presence in the state of Hawaii. And what that means is if we look at, and I'm not saying the coverage is exactly the same as what's proposed. Now, I heard HMSA talk about one hearing aid per year every 60 months. The bill proposes one hearing aid per year every 36 months. The bill has a minimum benefit of $1,500. I think I looked at HMSA's website, and I think generally their minimum their benefit is limited to $600. But that said, the bill also has the ability for insurers to require copayment or deductibles. All said, if we look at what is being proposed and the fact that it's already covered, I would suggest that there's very limited or very little impact, both socially and financially. Already covered. If we look at the number of people that don't have access to hearing aids, that's going to be challenging for us because there is coverage already. The people that can't get it because of the financial cost, again, challenging just because it is covered. I know there's a difference in what the benefit may be versus what the actual cost may be, but that's still going to be challenging for us to assess. And I think the result will be a report that is limited only obviously to the hearing aid device itself. And if the if the Kupuna Caucus or the legislators decide to introduce another bill next session, a bill that is mandating insurance coverage for other things beyond the hearing aid device itself, for instance, some of the other associated costs, I think that it's very likely that that bill will come back to my office for another one of these mandatory health insurance assessments under Section 23, 51, and 52 of the Hawaii Revised Statutes. So if that is the intent, and that's my understanding from talking to Senator Moriwaki and others, that the intent right now is that the Kupuna Caucus or the legislature or legislators will introduce a different form of the bill. In other words, it will not be the same bill that we are looking at right now, and very likely it will not be limited to the hearing aid device. And so I really am participating primarily to get confirmation of that, because if that is the case, then I don't think there's any value in my office continuing to do this assessment. I don't think there's tons of value anyway, just because it's already covered. But that aside, if we're going to do this and then have to do another assessment based upon a new bill that includes other types of expenses under the coverage umbrella, then we are not really spending our time as wisely and as effectively or efficiently as we should. Representative Hashimoto and the rest of the legislature gave us a lot of work this session. So we are trying to do our best, and it would really help us if we didn't have to do busy work, so to speak, if it's not meaningful. So anyway, I'm happy to answer questions, but if you have questions about the assessment that we do, I'm happy to talk a little more about that. But really, I wanted to talk about what we're going to do and the value, or maybe the lack of the value of us continuing, given what the bill that we are looking at, what it says, and given HMSA's and Kaiser's positions that the hearing aid device is already covered. Anyway, thank you.
Thank you, Auditor. And I see Senator Moriwaki's here. So Senator, welcome. I will turn it over to you, Senator.
I do have a question for Les, just for our edification and what we do going forward. And thank you so much for giving us your time and explaining to us the last one of the other meetings. But if we go forward and now it is lacking in the full coverage that is needed, it's not just the device which the Inflation Reduction Act covers, but it's really the assessment and the adjustment and so forth. If that is put into a bill, tell us the process. We just, like we did before, have a bill that's really more specific as to what we want covered, and then take it forward, and then do a resolution, a sunrise resolution again. Or can you just kind of walk through real quickly that steps? I know you don't have much time.
Sure. I think that if there's substantive changes to the current bill, I think that it's likely it should come back to us for another assessment. I mean, the purpose of the assessment, at least my understanding, is that my office is supposed to provide the legislature with objective information about the social and financial impacts of the proposed mandatory health insurance coverage that is in whatever bill or bills. And if that's the case, and there's additions to the current mandatory or the current bill, which is only hearing aids, that the device itself, and the additional costs may be, more than nominal, I think that it's probably appropriate for the legislature to send it back to my office for this review. So if that happens, the bill would be introduced next session, the 2023 session. The concurrent resolution would come to my office the end of the 2023 session. We would issue a report before the 2024 session, and the legislature, if it so chose, would continue considering the bill in the 2024 session. But like I said earlier, if there is an intent, which is my understanding, to submit a different form of a bill to include different kinds of costs, then I don't think that the review that we're doing right now is meaningful at all.
So do we need to do anything, or you would like to have the caucus send you something? I think that it's pretty straightforward in terms of the discussion that we've had, that just hearing aids, the device alone is really sometimes more harmful than not having them. So do we need to do anything, or
I think I would just like to get some confirmation from you folks, because I understand this is a bill that was the Kupuna Caucus was behind this bill. And if that is true, and the Kupuna Caucus intends not to pursue this bill in its current form, but intends to introduce or ask the legislature to introduce another bill that includes coverage for additional costs, then I would like that to be clear to me, so that we can memorialize that and advise leadership and the other legislators that we're not going to complete the report because. So I think that's right now my understanding, but I'm not sure it's absolutely clear to me what the intent is.
I'll ask my co-convener, Rep. Hashimoto. I think we've got enough people here on who have interest in the hearing aids issue, that if we asked people if they are for tabling this bill and coming up with a new bill next session that will address the broader needs for hearing aids coverage, could we get a show of hands? I don't know, in terms of what we should be doing, and let the auditor clear his plate on this one, but make sure he does a good job for the next one. Okay, do I have any down? I get all kinds of up, so I think, Les, that kind of is your answer. But if we have anybody with a down thumb, any down thumbs like that. Okay, we're going to take it as consensus that we would like to come in with a better bill next time that covers what we need to have covered. And I don't know if anybody wants to speak to that before Les goes, but you're welcome to say anything to give Les any kind of information or that he might need. So Les, you don't need anything from the caucus. I think this is where we'd like to go. And we may come back to you for help as we go.
Well, thank you for doing the poll right now, Senator. We'll just confirm that you will be copied. So will Representative Hashimoto on the letter that we sent to leadership. If there's concerns about what we say there, or we misrepresent what we understand this poll to be, then of course you folks should let us know. But thank you.
Thank you.
Thank you all. Do you need me still? Can I?
You can go.
Okay. Thank you. All right. Thank you all. All right.
So I'm going to have to go to. I have a plate.
Well, I think we are at a point where we just are at question and answers. So if anyone has questions for Lindsay or John, Rob, Wanda, Candice, I think this is the time now. Candice did drop some information into the chat, so make sure you take a look at that. That's some really good Medicare amounts and Inflation Reduction Act amounts. So Sarah, why don't you go with you, and we'll follow by Donald.
Right. I do want to know if there's any data from the two major health insurance organization about how much people are paying out of pocket for the Medicaid population, for one. And for Medicare population, since it's not covered, do they know about the needs of their elderly that is covered by Medicare who needs hearing aids but could not afford? Is it a concern for these healthcare organizations that their elderly member needs are not covered? So, and then for the employed seniors, their coverage is not clear to me. I guess it depends on, how much what the plan is covering. But in general, how much are these, members are being used, paid for, for their hearing aids. So if the health plans can offer us this kind of information, I think it would be very helpful for us to see which population require, more of our advocacy,
Maybe start with Wanda, because what does Medicare cover? What does Medicaid cover? Because we're looking, what I think Dr. Yuan is saying is what HMSA covers, Kaiser covers, and then there's this gap group in between, and then Medicaid covers, but Medicare doesn't cover. So
Correct.
what population in between, and I guess going back to HMSA and Kaiser after that, in terms of you cover X dollars, but do they not get it because they can't do their balance of the cost?
I'm not sure why Medicare isn't covering hearing, vision, and dental. This is an ongoing advocates want Medicare to cover those three
benefits
types of coverage. Yeah, so dental, vision, hearing. So not sure why they don't. However, the way this new rule would be benefiting people on Medicare is that they don't have to go see a hearing health care provider to get a test done and a prescription for a hearing aid. Yeah, Candace?
Can you just repeat the question one more time of what you want us to cover?
I think, Sarah, you can correct me if I'm wrong, but I think what she's getting at is, what is that gap group? I mean, when you listen to the auditor, he's saying, okay, who do you want us to cover? How much do you want the coverage? It should be specific. So if HMSA and Kaiser covers X and Medicaid covers Y, what's that in between? I mean, how many people are we talking about? Who are they?
Yeah, so for the Medicare population, as of 2022, there's 292,830 Medicare beneficiaries. And when we ran a presentation, I believe over 50% are currently Medicare Advantage members over original traditional Medicare. In Hawaii, Medicare Advantage is very popular, like HMSA and Kaiser, compared to the rest of the United States, where original Medicare is more popular. And I can get you the figure on how many Medicaid recipients we have in Hawaii. I have to find that in my archives, but I can chat the answer in the chat box. But that's usually the demographic and layout of the population in Hawaii.
And the 50% the 50% that are in the Medicare Advantage, do you have the coverage for that? Is it the same as HMSA and Kaiser? Or
you mean the member network? How many members are in each plan?
No, how much do they pay for hearing aids?
Oh, the benefits are different for every insurance plan. So depending on the provider, they have set benefits for each plan. So it would depend.
Yeah, there are co-pays and co-insurance costs for hearing aids in the various Medicare Advantage plans offered in Hawaii. So like Candace said, it just depends on which plan they choose. And if
so a way you could find that out is if you look at the plan's summary of benefits, which covers what the plan will cover. And if you look for specifically the hearing benefits, it will tell you what is covered by that plan. So we have access to the summary of benefits. Rob?
For a lot of them, it's like Humana and some of those others. It is a supplement that goes along the lines of what's called True Hearing. So it's a managed care program. Effectively, it's kind of like online hearing devices. They're typically very basic in technology, but also there's limited service plans and things like that. So that's kind of where the gap comes into. Even if the device ends up free, if you will, the providers are typically able to charge the members whatever they want to service the devices, clean them, test them, do whatever they want. So there are gaps in the supplemental side of it, but again, it's managed care. It's not really anything one-on-one with providers in the network or in the area.
So just one more question for HMSA and for Kaiser. So going back to Sarah's question, so you pay, I don't know, X dollars, and do you keep track of how many people aren't getting it, because that's not enough? I don't know, maybe you can't get that kind of information, but who's not getting it? Because even with the $1,500 or $1,000 that you get help on, that they still can't afford what they need. Is there any kind of data like that?
I would say anybody that can't afford the supplements, ultimately, we're just stuck with Medicare and only Medicare. A lot of Department of Vocational Rehab type of programs can assist with that. Some places have foundations and charitable things as well. So I would say it kind of, they're, left to seek something, again, on a charitable basis, more so than actual benefit or assistance from anything that they have for coverage.
Yeah, well, I guess to answer Sarah's question, I don't really know for sure. I think it's possible. It would be based on claims data. I don't think I could easily provide that to you. That would take some time, so I don't want to promise that. I think it's possible. I don't know if it's readily available. Excuse me. I did want to say, and I think this is going to where maybe the Kupuna Caucus's questions are like serving, right, our Kupuna population, right, that original Medicare has not covered hearing aids, right? And I think in doing my research, I was told that basically in its inception, and maybe Wanda and Candace can jump in, there was always the idea that consumers could make that purchase themselves. But I'm sure, as Rob would probably infer, and I think Lindsay and I would acknowledge, like, the cost of hearing aids keep going up, right? So what is sustainable, right? Obviously, it is the best thing for a consumer resident to be able to purchase a Advantage plan. Not everyone could do that, right? And so if we talk about trying to help our our resident population who maybe can't afford to purchase a senior Advantage plan, I did want to say, though, this is something, right, a lot of this is in the jurisdiction, I think, of Congress, but I think in last year there was a federal act called the Build Back Better Act, and the House passed that bill, but it actually would add hearing aids and hearing care to Medicare cover, like original Medicare coverage. That hasn't passed the Senate, but I think that and I think I see Audrey from AARP on here. I'm sure AARP nationally is very in support of that. So there are certainly gaps, and I would say, I'm only going to speak for Kaiser, but of course our mission is to try to ensure people have high quality, affordable care, right? At the end of the day, there's prices that are met, but it's to be able to try to make it as affordable as possible for folks. So I'll stop there. Sarah, I don't know if I honestly can promise that data. I wrote that down, and I'm probably gonna have to get back to Senator Moriwaki and Representative. I don't think that's readily available. So wanted to answer your question, or not. Sorry. Lindsay.
Yeah, Lindsay. HFSA, your thoughts.
Right. So this is a very good conversation to have, and there's a lot of moving parts. And I'm sorry, Senator Moriwaki, actually earlier we kind of went over a little bit of how the types of coverage that both HMSA and Kaiser offers with hearing aids, but just so you know, what if you get your insurance through your employer, both HMSA and Kaiser do offer hearing aid coverage. If you are on Medicaid, there is hearing aid coverage, and I believe there's no copay, but we can triple check that for you. And then when it comes to the population that the Kupuna Caucus really focuses on, our Kupuna here, right? Those who are 65 and older, that is under the purview of Medicare and the federal government. And unfortunately, as everyone has been saying, right, Medicare does not require coverage for supplemental benefits such as vision, hearing, and dental. And it's quite unfortunate that it's not required. There are some Medicare Advantage plans that do offer some hearing coverage, and I think we can all agree here that there needs to be more done. And I think that's kind of what the FDA and the Biden administration was hoping to kind of scratch the surface with the over-the-counter rule for hearing aids. Now, it's not quite there yet. I understand there are concerns, but that really the intent that the Biden administration has expressed was that it was supposed to create access for those with mild to moderate hearing loss who are 18 years of age and older, including our Kupuna, to be able to access affordable hearing aids.
Message the wrong guy.
What's that?
I thought it was Rob. iPhone.
Oh, wait. So where Lindsay's talking.
Yes. So, that's kind of it sounds like that's kind of the universe that we're kind of operating in now, and there are a lot of discussions that I think we can continue to have. I think it was a good step forward, the discussion that you all had with Les Kondo. I do want to kind of remind everyone though that when it comes to state legislation, that really it actually only impacts the commercial plans that HMSA and Kaiser and the others have. That's your working population. When it comes to the Kupuna, right, state legislation, unfortunately, we cannot direct the federal government to cover things. So, that, as John has said, is really in the purview of Congress, maybe working with our congressional delegation, reaching out to Medicare and trying to understand, what can be done in that space to try to help the Kupuna.
Donald has been patient, so I'm going to call Donald, your question or discussion.
Yes, thank you, Senator. Donald Sakamoto, a person that's legally blind and had some issues with hearing in the past. For me, over the counter, yeah, it can be wonderful, but when you have something that you're not too familiar with the segments of how it works and adjustments with the hearing aid, I prefer going to an audiologist and have my hearing checked with the machine, and then they usually give me a test sample to try out, and I let them know if it's okay or not. Because sometimes, like you said, people said it can do a lot more damage than good when you have a device that's not accurately tuned in. And being vision impaired is very hard to adjust anything, so I would have to have it taken in. And if I buy something over the counter and I don't like it, how do I return it and get my money back and try something else? That's a big issue I have right there. Thank you.
Thank you. Thank you for sharing that. Yeah. I'm going to be leaving soon, but I just want to leave with you all, and Rep. Hashimoto can carry on. It seems that it's a really important area, and I know it's related to a lot of other problems that you can have if you're losing your hearing and you don't know if you're mild or moderate, and then it gets severe. I don't know. Rob can tell us more about that, but I don't know if there's a smaller working group of people who really are passionate about this to work on something where you can identify what those components should be. And thank you, Lindsay, for looking at what Medicare covers and doesn't cover, but looking at who's to be covered and what costs are reasonable, so that we can help those who can't afford. I guess though that would be where we would start, because if there's coverage by HMSA and Kaiser and Medicare Advantage, where half of the population is already covered. We need to look at fine tuning this area and what the state can do. And as Lindsay says, to remind everybody that the state actually can regulate the state efforts, not Medicare, which is federal. So whether Audrey, AARP Kupuna Caucus can work on that with you, so that there's a stronger force to change Medicare rules so that it does cover. I think there's something here to work on to really fine tune it. So I'll leave that thought with you all, and I've got to leave for a plane too. So mahalo everybody, really good discussion.
Thank you, Senator. I know Rob had something, and anyone else, please be sure to raise your hand if you have any other questions. But Rob, go ahead.
I just wanted to add the connection that I keep hearing in regards to it's like buying or picking up a pair of readers off of the counter at a Walmart or a Target or something like that. And I guess that's, if I could educate anybody, that's one of the things that we really try to explain is that the way the brain processes sound versus the way we process vision is an entirely different process. And so to correct it, we are not actually correcting hearing. The device itself is really a prosthetic, as opposed to where we wear corrective lenses to reinstate 20/20 hearing. We can't, or 20/20 vision. We can't actually give back anybody 100% of their ability to hear. So again, the evaluation is important, not just to determine candidacy, but really to help us effectively fit the device so that the individual is hearing as well as they possibly can. And then also through the testing, we can determine not only severity, but again, what our expectations truly are. And then everybody's ear canals are different. Not only are mine different than everybody else that's on this call, but my right is different than my left. So real ear measurement and other forms of verification are absolutely necessary to know that a hearing aid is correctly fit. Otherwise, we're just throwing a dart at a wall. So we ourselves might as well be an over-the-counter operation if we're not doing what's necessary to verify the work that we're doing.
Thanks, Rob. Any other comments? Lei, go ahead.
I was just thinking, is it possible for the legislature to create a resolution asking our congressional people to look into the subject to make some changes to Medicare, because it is a federal problem instead of a state problem? So instead of us saying we have no hand in it, at least we can do a communication, and that's what we'd like to see our federal people do.
Yeah, absolutely. I think the Kupuna Caucus has a slate of 5 resos we can introduce, so that is another avenue that we can pursue. So hopefully we can, if that's something that you think we should pursue, we can definitely do that. But good point, Lei.
Okay, thank you.
I see Audrey's hand up. Audrey, go ahead.
Yes, since ARP's name was mentioned several times, I just want to let you know that the hearing aid coverage for hearing aid is an ARP priority nationally. And so this is a conversation that we did have with Congressman Kai Kahele, because we do know that it is the Medicare that would have to make some changes to adjust so that this could be covered. ARP up to now, though, however, as you know, was the biggest concentration was on the prescription drugs and getting that passed. And so now that got passed, I'm not saying that the ARP's, next biggest one would be hearing aid, but definitely all the other areas and benefits that we are really advocating for, including dental benefits, will be resurfacing again. So just to let you know that this has never been necessarily on the back burner, but hearing aid is definitely one benefit that we really feel it's important as well. So just to let you know, nationally, that's where we are in position right now.
Great. Thank you so much, Audrey. And, I know at the state level, you got your big retirement save. So now you have to find your new issue that you want to pursue. So we'll be interested to hear what's next for you folks as well. I know there's something up your sleeve, but great. Any other comments, questions? our time is getting a little close to our end period. I guess I'll throw it out to the group, but I don't know if Rick Tabor wants to take this on, or I think what we need is a few people who are interested in this topic to really take this on and see, get us some guidance of where you folks are thinking of you want to go before our legislative selection period on what we want to put forward from the Kupuna Caucus. So that time is quickly approaching. So people will need to be focusing on your top issues. So if you have any, if there's anyone that's interested in this issue, please let us know. I don't know, Rick, before Senator left, she said, ask Rick if he wants to take it on, but I'm not sure if that's what's interests you. So please let us know.
I'll continue to take it on, but I'll need help. So some of these folks have been very, very helpful that are on here. So if you want to work with, together, I'd really appreciate it. I've been taking it on for 5 years, not even knowing where this started from. So like, Audrey, do you know where this bill actually came from initially? No.
That's not me. I'm too recent.
So really interested in the Medicare piece, but eyes, ear, and dental, all, not just the hearing aids. It's just I'm on Medicare now. I'm just amazed that it's not covered, and so I think as a whole package, there's 3 areas that we need to focus on, but definitely the hearing aids I think is very important. My concern mostly, as you all know, because I've said it many times, is just the mental health issues that come from not being able to hear. That isolation is just not necessary. It should be covered. So should be and being is 2 different things. So I could use some help on this. I'm learning just as everybody else here is every day on this. I learned a lot today, so I really appreciate everybody's feedback here today. So thank you. Yeah, I'll head it up.
Okay, and so if you're interested, please chat with Rick or send Senator or myself an email, and we'll forward it to Rick, or email Rick directly, so we can get moving on this issue. I know Kathy has her hand up, so Kathy, go ahead.
Hi, thank you. This question is for Jonathan. I have Kaiser Medicare, and so $1,500 covers both ears. Is that what you're saying? What you said?
Do you have Medicare?
Uh-huh.
So if you have Medicare, no, the $1,500 is, I think that's the limit though. Well, so it depends, right? If do you have the right? We have an Advantage. Like, do you know if you have that? There's
Advantage,
a supplement.
Advantage Plus.
Yeah, I need to confirm on the exact dollar amount.
Well, don't
yeah, it's a $1,500, and it's for 1 or 2. I think it's for 1 or 2 every 36 months. So I suspect it should cover basically a set, like a left and a right, once every 3 years.
All right, that's what I thought.
Yeah.
Thank you.
Okay, thanks, Kathy. Thanks, John. Any other questions, concerns? Okay, if not, thank you so much to our presenters. I think this was a very, very informative meeting. Thank you for everyone for putting that together for our presenters. I know that takes time, so but I think the education, it was very important. So at least we're all on the same page of understanding of what we can control, what we cannot control, what the state can do, what the feds have to do. But I think all in all important in pushing this issue forward. So stay in touch with us if you have any other questions or concerns. We will see you in a month again for our next Kupuna Caucus meeting. And we will try, and we're getting closer to the legislative session. So we are putting on our hats to figure out what bills that we want to introduce. So keep that in mind, because those decisions will be coming up very shortly as well. So thank you for attending, and we will see you next month.